Hey there. Before we get started on today's episode, I wanted you to know that on February 21st, we are offering our first physician brand and AI bootcamp. You guys, this is a 3-hour working event. It's not a webinar, it's a workshop. You're going to be building stuff. You're going to be using our custom GPTs, making your own GPTs, and walking away with content generating agents that are going to build for you forever. It's going to be awesome. Please go to superdoctech.com/AI bootcamp and use the coupon code STORIES to get 50% off your ticket. It's going to be February 21st, Saturday morning, 9 a.m. to 12 p.m. Pacific. See you there.
All right. Welcome to SuperDoc Stories. I'm your host, Dr. Mona Sodhi, and today I have the pleasure of talking with Dr. Leslie Sanchez, based out of Portland, Oregon. Leslie is a fellow obesity medicine physician, just like myself, and I can't wait for you guys to hear her story. So, Dr. Leslie, let's get right into it. Why don't you tell us a little bit about who you are and what do you do?
Yeah, so I am an obesity medicine doctor here. I have a company called Radiance MD that I started about 3 years ago. I, a little bit about why I started it was that I was working for a big system and I was only getting 10 to 15 minutes per patient. And as you know, as an obesity medicine colleague, our patients are very complex and a lot of trauma. There's reasons why they are struggling with their weight. And so I really wanted to have time with them. And I also wanted to be able to kind of really teach them a holistic approach. So I started this company when it was basically what got me to start it was that my supervising physician told me that their whole method was treat and street. So kind of get patients in and get patients out. And I wanted to be able to sit down and really listen to patients. And so I started this company. I work out of Lifetime Fitness here in Oregon. I have my little office here, and I get to spend 45 minutes and lift weights with all my patients and teach them how to cook, hike with them, and really spend time.
If you're enjoying SuperDoc stories and thinking about building a practice on your own terms, you're probably wondering how to get all the tech pieces to actually work together. SuperDoc Tech is the operating system for cash pay practices. Mona and I built it for our own clinics, and now we're sharing it with physicians everywhere. It captures every lead, books more visits automatically, and runs your patient acquisition 24/7 with AI and automations. New practices can skip years of guesswork. Established clinics finally get a back end that works. Head on over to superdoctech.com and use coupon code PODCAST50 to get 50% off your first 3 months. That's over a $1,000 value. Now back to the episode.
That's amazing. So many things to unpack there, and I want to ask you about how you developed that relationship with Lifetime Fitness, because I think that's something our listeners may want to know more about. But tell me about, like, previously, before you left your employed position, was that an obesity medicine position or a PCP type of position? How were you
Well, I
working at?
was working out of the bariatric. Well, I'm actually a hospitalist, but then I was also working out of the bariatric medicine, working with the bariatric surgeons, and then doing bariatric medicine also.
Okay, awesome. Now, was this starting Radiance MD, was it your first time getting into kind of entrepreneurship, building a business, or had you done it before?
No, I when I was 16, I started a company. I was a personal trainer, and so
Okay.
I actually had a really booming business at age 16 because one of my patients was owned 18 McDonald's and lost 80 pounds, and so then she was my walking advertisement.
Wow.
And so I had really a really booming business when I was in high school. But then I kind of went on to college and medical school and then all of that. And so this is my second uh, entrepreneurship, I'd say.
That's
But,
amazing.
just obviously we don't learn anything about how to run a business in medical school. So this is, there's been a lot to learn. It's been a steep learning curve for me.
Yeah, definitely. And when you started 3 years ago, what was kind of unexpected or messy? And how did you kind of move on for it? Because, like you said, we don't get a business education in medical school. So, getting into your own practice, and I'm sure you face some challenges, as we all do, opening up our own business. What are some of the things that you recall as being a challenge when you first opened up?
I think the biggest thing was that I really wanted to be a doctor and not um, an administrator. I think just setting up all the LLC and trying to decide if I want to take insurance or not, um, ha just all of the endless emails, I'd say, trying to set up a company.
Yeah.
And I think still that's one of the challenges is how to balance being really what I want to do is the time with patients versus um, spending time doing the administrative piece.
Right. So kind of wearing the clinician hat versus the administrator hat. And we
Exactly. Yeah.
definitely, within SuperDoc Tech, we're coaching our clients on how to kind of spend time in that role of administrator versus clinician and how they're separate roles, but they integrate. And we have signed
Yes.
up for something that involves both, and that's okay. So how do you have time that you set aside every week to kind of take care of the business side of things, or do you feel like it's just always happening in the background and you're dealing with things as they come?
Well, I think I've gotten much better at setting boundaries. I think that's really the big thing because you could spend, 24 hours a day just responding to messages
Yes.
or, doing the
Yes.
administrative piece. But I have two admin uh, assistants who are actually in the Philippines, and it has been really life changing. So one of them works from 8 until 1, and the other one from 1 to 5, and they are
Amazing.
great. Um, and one of the things that just recently I had to do is say, okay, after 5 o'clock, no more messages. So even
Right.
if it has to go till the next day, then it's okay. Because otherwise you have to miss all that time with your family. And so that's been my big resolution for this year is 5 o'clock, I'm done.
Yeah.
So yeah,
I love that. I think that setting boundaries is extremely important as an entrepreneur in any business, really, because when you're an
yes,
entrepreneur, I think our brains work a little bit differently where we don't clock in and clock out. We're just always thinking, dreaming, what's the next thing? What's the next fire to
yes,
put out? And setting that boundary is so important. I love that you have hired some virtual assistants. And for anyone listening, Dr. Leslie is probably the 10th physician we've had on this podcast to scream, to everyone like you need help. Checking
yes,
email every day is something that can be outsourced. So if not a virtual assistant, look into other ways to outsourcing it to get back your time. Because really, anytime you're in your inbox, people are basically getting your attention and your time, which is likely better spent in another way. I also have virtual assistants checking both my SuperDoc Tech emails and my Monarch emails. And I'm really not even in Gmail. I just need to know what I need to know, and my virtual assistants understand that. So, coaching your virtual assistants is probably something that you've had to do and telling them, what's urgent and what can wait till the next business day. So, um,
yes.
I think that building your team is extremely vital when you're becoming an entrepreneur. So, great job. And hopefully, for our listeners, it's resonating with them that this is how you really get your time back.
And I think I would add to that when they ask questions, I've been kind of responding with, well, what would be your approach to this?
Okay.
Instead of just answering the question,
Yep.
asking them, what solution do you come up with?
That's
And I
great.
think that really builds the confidence because they're much more capable than they know sometimes,
Yes.
and that just teaching them that they can do it without that, not the medical decisions, of course, but
Right.
they can do the admin decisions without me most of the time.
Yeah, that's great. So building autonomy, a little bit of autonomy with some guardrails, empowering them to make the decisions that they're able to. That's great advice for our listeners. I know there's so many people that just hesitate to get their first assistant, and I
Yeah,
really encourage most people that you really need to know, Buy Back Your Time by Dan Martell is a great book to learn about this and, what your hourly rate is and figuring out, okay, for tasks under X dollars an hour, that needs to be outsourced. End of story,
Yes,
because your time is more valuable.
yes.
So that's a great book that has taught me a lot when it comes to buying back time and outsourcing all the things that I don't like to do, whether it's, laundry or,
Hey, do you
answering
outsource your
email.
laundry? I like that.
Yeah, yeah, yep. The model has changed quite a bit. I've been through different iterations of having it sent out to having it done in-house to my kids really pitching
Uh-huh.
in on it. I've got three kids, and so I'm trying to teach them to do their own laundry um, as a skill. So let's talk a little bit about, we talked a little bit about what was hard. What's working well in Radiance? And tell me kind of, I know you've got a unique practice in Lifetime Fitness where you offer things. I see that you've got some equipment behind you. So you're not a
Yeah.
traditional, just chat with your patients and write a prescription. I mean, your model is pretty different than a typical physician practice. So tell us a little bit about that and what's working.
Yeah, and I should clarify too that so there's lifetime fitness and then there's lifetime work, which is attached to it. So for those who don't know, it's a huge gym, but they have a collaborative workspace. So I don't work for Lifetime. I'm just in their workspace, but it's attached to the gym. And so what's nice for me is that I see patients and then I have blocked out every day between 9:45 to 11:15. I run over and do my own strength training class or a hot yoga class, and then I come shower and then I come back and see patients again. Uh, but as far as with patients, what I do is I spend 45 minutes with them. They come in and I do my 3D optical imaging body scan, which is like 98% correlated with a DEXA. And so we make sure that they're gaining body, a lean body mass and losing body fat every month.
Mhm.
And then also during the appointment, we make a nutrition plan. Help them track their foods. And then I also lift weights with them during every appointment and teach them how to weight lift. There's a track which is on the roof over here too next to me. And so when it's sunny, we actually the entire appointment, we walk, besides the body scan, we walk for our entire appointment. And I have my AI scribe attached to me, which is wonderful. And I think that's another thing for entrepreneurs in medicine is an AI scribe is the way to go because you can basically just attach it to you. And then by the end, your note is mostly complete. And then you just edit a few things and sign. So I'd say I spend less than 5 minutes per note.
That's amazing. That's got to be a
Yeah.
record. And thank you for that very generous tip on the AI scribe. I know, again, that's something that you're an early adopter for because a lot of doctors are hesitant. They're not sure if it's right for them or their practice. Some people think that it's only meant for big, busy insurance-based practices, but actually for boutique practices, kind of like you and I have, it can be really helpful and efficiency
Yes.
is important. So that's wonderful that you've been able to adopt that and you get a workout in and your patient gets a workout in. I mean, there's wins all around there. That's fantastic.
Yeah. And I mean, I feel like that's the thing is we are always physicians are always counseling other patients on taking care of themselves, exercising, eating well, but we're not doing it ourselves. And so what better role model than actually doing it? Sometimes I'm looking disheveled when I come back to the patient appointment because I've just showered and come from the class, but they get to see that I'm making it work even amidst a very busy day. And so really there's no excuse. A lot of times, oh, I don't have time for it. Well, you just have to make it as part of your day or it's not going to happen.
Yes.
And
And
as a busy mom yourself, I'm sure like by the time you get home, then everybody needs something from you and it's hard to make it happen unless you do it
yeah,
early or late. Yeah.
yeah. I think that's something huge for our listeners, which is just be your authentic self and show up messy. I mean, it's okay.
Yes.
And you're clean, right? You've showered. So we're not saying,
Yes.
don't shower and go to work, but, you're showing up as you are and you're doing what needs to get done. You're getting your workout in and then you're seeing your patients. And it doesn't have to be perfect, right? You've heard this, the saying, done is
Exactly.
better than perfect. And so you're getting it done. You're showing them what real life is. So I love that. And I think a lot of our listeners, they're in that, that pre-contemplation phase of starting a business where they're thinking like, it's got to be perfect before I launch. And I'm like, no, no, it doesn't. Like the best thing you can do is just start. Um,
Yes.
what it was for me, I remember before I opened Monarch was my landlord, who is an amazing human, and a physician herself, just said, I have this space available and I'm only going to hold it for you for a couple months. And you've got to put your deposit in right now to hold it. And that was it. That was the fire that I needed.
Yes.
Just take one step in front of the other. I didn't have my LLC. I didn't have a bank account. I didn't have a plan. I just said, okay, I've got a space, and that's it. So
I love
for
it.
those of you
Yeah.
listening, it's just that the momentum, right? You just need to get that momentum going, and you do that by taking action one step at a time. But if you're waiting for perfection, you're going to be waiting for a long time. So
Yeah.
it's better to
And
just
I
do it.
like, one of my mentors that says, do it afraid.
Mhm.
It's okay to be afraid or not
Absolutely.
to have all the details down but yeah, you can get paralyzed by perfectionism.
Yeah, yeah. So, Dr. Leslie, you've been open for 3 years now. Tell me, kind of, has the way you practice in your obesity practice, has it changed or has it largely been the same? Like with you walking on the track with your patients and doing weights, or has it kind of morphed during these 3 years?
Yeah, absolutely. I have, I think at first I was seeing patients for an hour and I realized that, 45 minutes is good amount of time. I'm really trying to balance, paying all the bills, because it can be expensive.
Mhm.
And so it was good to go down a little bit in time. Um, I would say, I mean, just I get one of the big things that's changed is one of my patients who's lost 180 pounds and kind of is no longer my patient, started to work with me. And he teaches people how to cook. He teaches them how to meal track and how to meal prep. And so um, I think having somebody who's really been through it like that has been very helpful to make people feel that they're not alone. Um, I guess my biggest goal is to walk side by side with people, and that's by actually lifting weights with them, by actually cooking with them, by really being practical and teaching them how to do it. Because as you know, many of our patients in obesity medicine have felt shamed and condemned
Mhm.
that and hopeless. And so
Right.
I always say my mission is to bring hope to the hopeless.
That's
That's what
amazing.
I do. That's why I do what I do.
That's amazing. So that patient you mentioned, so it's a patient that was taken care of by you and now has come full circle to help your other patients out.
Yes. Uh-huh.
That's amazing. That's fantastic. I love that. And do your patients, I'm kind of curious about this. Do your patients have access to in between visits, or is it strictly like the 30 or 45-minute visit and then I'll see you next month?
Well, my assistants are on text. They are so patients are constantly texting questions
Sure.
to me through them. I personally don't have an inbox where people can message me,
Mhm.
and I think I learned from doing a short stint of primary care that that can take over your life, where it's just these long messages that come through. And since they see me every month, really they see me regularly. But if there's anything that is in between, they just text and then my assistants kind of screen questions. So it's just not like these long books that come through and then where you
There's
could
a
spend so
filter.
many hours responding to them.
Yeah, so you've kind of set up a boundary again with your assistants kind of being the first pass of their questions. So
Yes.
that's fantastic. I have a slightly different model where patients are able to access me at any time via email or secure text message. But I do find that a lot of people don't use that functionality because I happen to take care of a lot of busy professionals that simply don't find time to do that. So
Yes.
it's funny how it kind of balances out as long as you set your boundary and you say, this is for emergencies or this is for clinical questions only. People really respect it when you lay it out. But what's important to know, I think, for our listeners is that you can set up your practice with whatever suits your lifestyle. So if you
Yes.
want to set the boundary and you want to see your patients every month and they know that's their time with you and you give them your all during that time, that's excellent. There are other models though where there's a little bit more handholding and there's a little bit more like checkpoints, like how did this week go? And sending automated texts out to kind of remind them, like, hey, one of our clients is actually doing that where she has modules that she'll send out month over month, where it's like fitness one month and then nutrition another month. And so she's got automated systems in place to kind of remind her patients, like, hey, remember this month you're focusing on nutrition and this month you're focusing on fitness. So it's pretty cool that we can really
Yeah,
set up our practices however we think our patients need us.
absolutely. And I guess one thing I did forget to mention is I have three personal trainers who work for me. And so my patients do see them actually
Yeah.
weekly. So
So they have a lot of
that
time.
is, they do have that weekly accountability
Yeah.
with a personal trainer and health coach. And then so if they need anything, they can also go
Yeah.
through the trainers and then
Yeah.
get to me. But usually
Yeah.
by the time they see me monthly and then the trainers weekly and then the cook, the my patient who helps them meal prep, they're kind of they've had enough of us. I was kidding.
Yeah, that's a lot. And we didn't even
Yeah.
get into that, but you've got different types of packages that you offer that some of them are bundled with nutrition and fitness. And then they're obviously getting all of that when they see you as well, because they're getting a mini
Yes.
workout in. So you've got layers built into your program. So hopefully this
Yeah. And then
sparks
we
some
kind of send
inspiration.
them some video workouts too, like
Yeah.
about how to some exercise plan that they can do at home too.
That's something excellent because that's something that you can record once and then send out to your clients over and over again, the same types of core exercises or lower body. I know one of our docs actually has like a GLP guide that she offers to patients. So the sky is the limit, especially with
Yeah.
technology now. Like you can do whatever you want to do in terms of patient education, touch points between appointments. So it's really inspiring to kind of talk with you about this because we both serve a similar population, but just in slightly different ways. And
Yes.
it fits, your personality as the doctor and also your ideal client, right? Whoever it is that you're serving. So thanks for sharing all of that. I just have a couple more questions. In terms of being the founder of Radiance MD, has that process of becoming the founder changed how you see yourself?
I think so. I think it's brought me a lot of freedom because I've always had all these visions of and passion for how I want to practice medicine. And I think many of us, when we go into medical school, we really want to be changing people's lives and having that impact. But we get caught in the treadmill of
Mhm.
just producing more and seeing more and moving faster and almost robotic, I'd say. And so I feel like the shackles have been lifted from me, where I'm just not uh, feeling like a robot. And not, and it's not because, like I said, sometimes patients think that it's the doctors that are trying to rush them through, but it's really not. It's the medical system that
Right,
is making them have to work faster and faster, where that's not what they want.
right.
Uh, so I'd say, yeah, the shackles have lifted. And interestingly, so 85% of my patients are doctors, and that's because I'm the founder of a group of 2,000 doctor women in Oregon and Washington called Oregon Physician Women's Group. And so that's how where they come to me through that group. But and I get to see that doctor after doctor after doctor is just burned out
Right,
to beyond belief.
right.
Where I just saw a patient earlier today who was in primary care, and that her system said, "Oh, even though you have 3,000 patients assigned to you, we're taking the cap off. So there's unlimited amount of new patients you can get,
Wow.
but you don't get any admin time to take care of them." And so, I mean, it's just not realistic for doctors these days to
Yeah.
practice and be healthy themselves. And so
Yeah,
that's why they're coming to see me because they're not healthy, but they're feeling stuck. And
right.
so that's why I think what you do is so important and to kind of help people find that bravery to get out on their own and out of that system where they just feel crushed.
Yeah. I love that you said that it feels like you're free of the shackles of medicine in the
Yeah.
corporate world. Yeah, at SuperDoc Tech, that is our mission is to help doctors be freed from that if that's what they want, and to build something that nurtures their patients. And so if we even have a fraction of a percent contribution to that movement of the freedom of doctors, we're all here for it. So D Dr. Leslie,
And I think, well, I
yeah,
just want to say one last thing about that. It's also bringing meaning to the doctors themselves, where it's for nurturing the patients, but also nurturing themselves.
exactly. 100%. And you have more longevity if you're nurturing yourself versus you're on the hamster wheel of, endless administrative tasks where you have no time to do them, like you just mentioned.
Yeah.
Yeah, so that's huge. So I think a lot of doctors are taking their power back, um, one
Yes.
one practice at a time. And I love to see it. It's so inspiring. So thank you so much for sharing all of
You're
that with us.
welcome. You're
Uh,
welcome.
so, for our listeners that want to get to know you, maybe work with you, how can they find you?
Well, you can go to my website, which is www.radiancemd.org, or follow us on Instagram or Facebook as well at radiance underscore org. And I'm licensed in 10 different states, but including Oregon and Washington.
Okay.
And you can see on my website, but just call the phone number on the website. And it's 971 I dance too, because I'm also a dance instructor.
Oh, I
I'm a
love that.
salsa dance instructor.
That's amazing. That's amazing. I saw that you had won some competitions of that and eating some spicy food as well. So
Oh yes.
we'll
Well,
have
I'm
to
from the
continue.
Southwest.
Yeah, we'll have to continue this conversation just based on your accolades when it comes to dancing and salsa and all that. So thank you so much, Dr. Leslie. We'll make sure to include all of this in the show notes so that all of our listeners can find you. And thank you again for sharing your insight and being an inspiration to all of our listeners here at SuperDoc Stories.
Oh, you're welcome. It's a pleasure to be here.
All right, take care.
Okay. Bye bye.